Good afternoon. You'll notice that this is a slightly different format of the Mayor's Update and will be a question and answer session. However, before we start, I want to thank everyone out there who is behaving responsibly throughout this entire ordeal. We really appreciate it. But specifically, I want to thank all the people that are bagging groceries, that are stocking our shelves, all of the people working in essential businesses, all of the people that are making our food and still serving our food for those of you who are picking up from our restaurants. And thank the people that are actually supporting those people. Thank the people who are out working at gas stations, the auto service people that are working on cars. But most importantly, I want to thank our first responders for risking their lives to go out and take care of the people that potentially have COVID-19 and potentially exposing themselves. And lastly, and certainly not to be forgotten, are all of the medical professionals, the nurses, the doctors, and all of the other assistants that are working in the hospitals and in medical settings everywhere that are potentially being exposed to this in order to take care of this life-threatening issue. So thank you very much to them, and please keep them in your thoughts and prayers. And now we'll start with our first question.
How many cases are there of coronavirus in Orland Park?
So for this, I'm going to have to go to my notes. I'll start with, there are 190,297 cases currently reported in the U.S. There are 5,994 cases in the state of Illinois. In Orland Park, according to Cook County Public Health, there are 30 cases. However, as of this time, our fire protection district has only transported 5 of those cases. So that's what we know that is out there right now with those cases. And it's really important that people understand that one of the things we're fighting more than one thing here. One is we're fighting the virus. The second thing is we're fighting hysteria. But fighting the virus, that's first and foremost. And what you can do about that is practice safe social distancing, stay 6 feet apart, wash your hands, follow good hygiene. It's very important that people follow that. Those of you who are not following that are putting other people's lives at risk. It's unnecessary. Please think of others, keep a safe distance. You can still go out and do things, but please keep a safe distance, wash your hands, and follow proper hygiene.
Why aren't all the people of Orland Park being tested?
All the people of Orland Park are not being tested. I get this question a lot. And they're not all being tested because, one, we don't have the test kits. Currently, the CDC, Illinois Department of Health, Cook County Public Health, they're testing those cases. They're testing 2 cases, people that have been exposed and people who have symptoms. Those are the people that are testing, which is why you need to reach out to your doctor or your healthcare professional and ask them what you should do in the instance that you feel that you're sick. Don't go to the hospital. Since there's nothing that can be done for this, there are no cures, it's only comfort. If you are like most people, over 80% of the people that have very few symptoms or no symptoms, they will tell you to stay home and just care for yourself at home and to monitor yourself. But for others, they'll have you come in. But in any case, they will tell you where to go for testing, or they'll bring the testing to you. And at this time, there's just not enough kits. From a testing perspective, what we really need to have all the facts is we need to have an antibody test, which is called a serology test. And that's where they take your blood and test to see if you have antibodies for this. We don't know how long those antibodies will last, but we think if it's a typical virus, they'll at least last for several months. Without that information, we don't know who's already been exposed, and there may have been millions of people already exposed. We just don't know that. Because, again, many people don't show symptoms whatsoever. Many children don't show symptoms at all, and so they may already have antibodies in their system. And until we get that testing, we really won't have all the facts.
Are village employees still working while buildings are closed?
Village employees are working, our essential employees are working, and as well, several of our other positions have been rolled into essential positions to help. Our perspective here at the village is that our employees are being paid. They're being paid by you, the taxpayer. We want to have them doing as many of the essential tasks that need to get done, because when this ends, there will be more things to be done. So anything that we can get done at this time, we are doing. Now, buildings are closed to the public, but we are still processing things like building permits so that our construction crews can keep working. We are still processing payments online. We're still doing all of that. Our water department is still working. All of the things that keep you safe, besides the obvious, the police are still working. All of those other background organizations and departments are also working.
We need testing centers in Orland Park. Why haven't you put any here?
Well, first off, it is not my decision to make whether or not to put a testing center here in Orland Park. It's the decision of the Illinois Department of Health, Cook County Public Health, and the CDC. So that's why there are no testing centers. If they felt there were testing centers needed here in Orland Park, they would put them there. The bigger issue with the testing is the labs at this point, is how much they can process. And there are, to my knowledge, at the last time, there are 15 or 16 labs in Illinois that can do those tests. But for that reason, we're not going to set up a testing center. If, however, the Cook County Public Health, through the CDC and the Illinois Department of Public Health, decide that we need a testing center here, they will let us know where they're planning on doing it, and hopefully they will coordinate with us so that we can make sure that the flow of people makes sense and do not impede public safety in any other way.
What do they mean by flattening the curve?
So by flattening the curve, what they're trying to do is slow the spread of this virus. At the end of the day, this is a virus, not unlike the flu or chicken pox or polio or smallpox. The thing is, it's a virus that we've never had here before. And in talking to the infectious disease experts about this, it's a new virus, which means this virus is going to be with us for the rest of our lives. It's always going to be on the planet from this point forward. And so the number of people that get it, barring a vaccine, which would change the numbers because you can immunize against it, which is one of the reasons why not as many people get flu, or some other game-changing events that cause this to spread at a slower rate, the number of people that are going to get this isn't going to change. So when they flatten the curve, it doesn't mean that less people are going to get it. It just means that it's going to spread more slowly. And at the end of the day, talking to several experts, as well as reading several experts on infectious disease, herd immunity isn't going to happen until 50 or 60% of the population has it. That's when it will not spread as quickly, because many of the people that you come in contact with on a daily basis already have immunity to it. That will happen at, again, 50 or 60%. Well, if you think about that, in Orland Park, that means 30,000 people will eventually be exposed to this. But again, keep in mind that it is only the people, primarily the people with underlying health issues, that are in danger from this, and most people, the overwhelming majority, may not even know they ever have it. So that's why it's really important that we slow the curve down, so that the reason we're doing that is so that the healthcare workers, the hospital beds, aren't overwhelmed all at one time. If we can spread this out and slow it down, we can manage it much more effectively. But it doesn't mean that less people are going to be infected. It just means it's going to take longer to get people infected.
Why are people still using our parks and trails? Aren't they supposed to stay indoors?
So they are still using their parks and trails because they're allowed to use their parks and trails. And if you talk to the experts, if you watch the last video that we did, our experts encourage people to go outside, because this is not an airborne virus. This is spread by droplet, and that means an airborne droplet, a droplet that moves through the air, is not the same as being airborne or aerosolized. So that's why people can go outside. And I'm going to specifically at this point read the governor's executive order so you know exactly what you're allowed to do. So people are allowed to leave the home for essential activities. Leaving the home for essential activities include health and safety, and for outdoor activity is the second one. Now, for outdoor activity, it specifically says to engage in outdoor activity provided the individuals comply with social distancing requirements as defined below, such as, by way of example and without limitation, walking, hiking, running, or biking. Individuals may go to public parks and open outdoor recreation areas. However, playgrounds may increase the spread of COVID-19 and therefore shall be closed. They can also go outside for certain types of work and to take care of others. But back to the playgrounds may spread. That's because this gets spread largely by staying on surfaces for some period of time because of, again, droplets, perspiration, that type of thing, and that stays on it stays on the surface and then somebody else touches the surface. And since we can't continually sanitize playgrounds, that's why playgrounds are closed. However, basketball courts are open. Tennis courts are open. Now this goes back to the people that are not following safe distancing and social distancing requirements. Please don't congregate on a basketball court. If a few of you are shooting hoops, that's fine. If a couple people are playing tennis, that's fine. But if we start to see 15 or 20 people out there together playing basketball, or even 10 people, we're going to disperse you. We are not going to close tennis courts. We're not going to close basketball courts because, again, outdoor activity is really important. It's important for your mental health. It's important for it's important to get exercise. It's a very stressful time for a lot of people. One way to get rid of stress is to be outside. And if you listen to the experts, listen to the infectious disease experts from Palos Hospital, they actually encourage people to be outside. This virus spreads less if you're outside. You're more likely to contract it in an enclosed space. Outside, the virus gets dispersed more, so it's less concentrated, so you're much less likely to catch it. It's the same common sense rules you've used for the flu and everything else. Go out, when your mom told you go out and get some fresh air, go get outside. It's the same things apply here. So that's why those things aren't closed, and we won't close them. But we ask you, please, please, follow social distancing when you're out there. And everything that I've witnessed and I go to the forest preserves that are in the area, I go to our parks, I'm out there regularly, have been out there almost daily in the last 2 weeks. People are really doing a great job of following the social distancing guidelines. I have not witnessed any problems. I know our police chief and I talk about it all the time, and he's been out there as well, and he has not seen any problems. So thank all of you for doing that, because it makes it a lot easier on us, because the people that don't follow it might wreck it for everyone else. And that's what you saw down in Chicago. We don't want to have that here.
Why aren't the police stopping people who are out shopping for non-essential goods?
So it's not our police's job or anyone's job to go out and say what's essential and what's not essential. These businesses are open, and if people think they're essential, they can go out there and shop. I would encourage the people who are asking these questions, and a lot of people ask me these questions, that they examine themselves, because one of the other things that we are fighting through all of this is we're fighting hysteria. I said we're fighting the virus, we're also fighting hysteria and panic. And the people that want me to arrest people playing basketball, that want us to stop people from shopping for non-essential goods and check them all, they are not helping the situation. The people that are on social media suggesting that this is an airborne, aerosolized virus, and creating hysteria about the number of deaths and everything else. People are well aware of the facts of this and that this is very dangerous, but acting like that does not help the situation either. And it causes people to panic. And additionally, when I say that the people who are not following social distancing can potentially cause everything to be shut down for everyone, so can the people that are acting hysterical about someone going to a particular store or whatever. That can get shut down for everyone. And it's important that people can get groceries. They can go out and go to the hardware store to fix something in their home. It's important that they do all that kind of stuff. And the last thing we're going to do is become a police state with all of this. The people of Orland Park have been fantastic, and they will continue to be. The stores have been fantastic about trying to keep people separated. One thing I will say I have gotten a lot of complaints about is people just throwing their gloves and masks down in the parking lots. That's, one, it's disgusting. It's disgusting even on a day-to-day basis, but especially with COVID-19. Please be considerate. I mean, this is just common courtesy. Take your gloves, take your masks, and put them in a trash can, please, and don't leave them out there, because somebody else is going to have to pick those up, and now you're potentially exposing them if you're exposed. So again, this all goes back to common courtesy. You think of your neighbor. Don't worry about what they're doing. Worry about yourself. Take care of yourself. And if you take care of yourself and everyone does that, we'll all be better off.
So many businesses are hurting in Orland Park during the crisis. What is the village doing, if anything, to help with economic recovery after we get through this?
That's a really good question. And the federal government, the state of Illinois, Cook County, and the village will all be doing things to help our businesses, because we're fighting three things. We're fighting the virus, we're fighting hysteria, but we're also going to be fighting for the economic recovery that follows this. And the federal government passed the CARE Act. That information can be found through the federal government, through the county government, also on the Village of Orland Park website. We'll have information on how you can get to that. Additionally, the state of Illinois Treasury has some loan programs available, as does Cook County. The Village of Orland Park is working on some various packages to put together to help our businesses when this ends. We're not going to roll those out until it ends, because we don't know when the end is yet, and we don't know everything that's going to be needed. But we are working on it. It will be announced, but it won't be announced until the stay-at-home order ends.
I received a phone call from someone asking about my information to apply for these various CARE Act benefits. Is this official?
This is not official. So at this time, there are a lot of scammers out there trying to prey on people. If they're people that are asking for your checking account number to pay a bill, no legitimate company is going to do that. Regarding the CARE Act and the $1,200, that's going to be determined from your tax return automatically. And if you have a direct deposit on your last bill, or excuse me, on your last tax return, if there's a direct deposit number, they're going to deposit directly into that account. If you don't have direct deposit, you need to reach out to the federal government, to the Treasury, and give them your direct deposit information, because that's how they're going to be sending these out. So if you've gotten direct deposits in the past for your taxes, you're fine and you have nothing to worry about, but they will not be contacting you and asking for your information.
How do I get my local news now that the Prairie has shut down their publication?
So this is one of the issues, obviously, with recovery and the economy that I've been talking about, is that some of our businesses aren't going to make it. And the Prairie is one of those businesses, as is, I found out yesterday, Rock Bottom Brewery, who was doing just fine until this happened. So those are two businesses, and there are likely to be more. As far as the Prairie is concerned, it's going to be a loss because they cover all of our local news. I don't know what's going to fill that void. The other newspapers don't cover it as well as the Prairie has, and obviously the Prairie gets sent to everyone's mailbox. The Village will continue to keep you updated with Village events, so you can always go to the Village website to find out about any of our parks and recreational events, any of the programs that we have, as well as you can watch the Village board meetings online. You can see the minutes. You can get all of that information on the Village website. But as far as covering, Sandburg sports or other local sports or Marist or any of the others, you're not going to get that from the Prairie. So in closing, I want to thank everyone for all those questions. They were good ones. As I've said many times, this virus is negatively impacting everyone. It's a tornado, an earthquake, a hurricane affects a local area, might affect a whole country, but it doesn't affect the whole world. Everyone in the world is being negatively impacted by this. Businesses big and small, people rich and poor, governments regardless of where they are in the world, everyone is being negatively impacted by this. And we're fighting on multiple fronts. We're fighting the virus, as we've talked about. For the most part, CDC, Illinois Department of Health, is on the front line of doing that, as are some of our first responders, and then obviously our medical professionals. What can we do to help with that? Please follow your social distancing guidelines. Please wash your hands. Don't touch your face. Those are the things that you can do to help us fight this virus. The second front we're fighting is hysteria and panic. So what can you do about that? Don't worry about being the police for your neighbors. Don't worry about policing whether or not they're shooting basketballs or they're walking on a hiking trail. If you feel so uncomfortable that you can't go outside, then please stay inside. But don't try and put all of that on everybody else, because being outside for other people are healthy. Don't try to determine what is essential for other people. Let them go about their lives. If you're panicked or scared, try not to write those things on social media. Don't post things that are not factual on social media. All you're doing is creating hype and people don't have right now they have a lot of time on their hands, and all it does is create more fear. That's not helpful. Hysteria and panic is the enemy that we can all control. So stay calm through all of this. This is bad. We all know it's bad. Okay, but it's not end of the world bad. It's a virus. We have a plan in place. We're dealing with it. We're adjusting. The whole country's adjusting. The state's adjusting. We're adjusting. And on that front, I've seen many people bashing the president, bashing our governor. Keep in mind, they're working off of more information than you and I have, but it's imperfect information, and they're doing the best they can with what they have. So please give them the support. They're doing the best they can with the information they have, and try to keep social distancing and remain calm. The very last thing is that we're going to be fighting for an economic recovery when this is over. So I will continue to work with the governor, who I'm sure will be working with the president, on how we can start to open things back up so we can get back to normal. And at that time, it will be important for people to still keep a social distance, and it will be important for people to not get hysterical about things that are starting to be opened again. Because keep in mind, you may say it's a non-essential business, but for that business person that's put 20 years into their business and they're losing their livelihood, it's pretty essential. So we're trying to get these things up and running as fast as we can, but hopefully we'll do it in a smart and safe way. With that, I want to thank all of the people of Orland Park who have done a phenomenal job. The overwhelming majority of you are following the social distancing guidelines, the hygiene guidelines, and you're being respectful of others, and we really, really, really appreciate it. It speaks volumes to who we are as a community, and thank you.